Hi everyone, this is the next episode of Left Not Liberal. I was originally going to make this about Chris Kobach, but I'm going to do that probably next week now. So stay tuned for that. It'll probably be up sometime around Thursday, maybe even Monday if I get the script written earlier. But today I'm going to be talking about the issue of healthcare, and this is a really important issue in the United States right now, mainly because we have this new healthcare bill in the Senate. Now, I'm not going to talk about the bill specifically. I'm going to talk about a protest that happened in D.C. over this issue. Now, Washington Post reporter Dave Weigel recently tweeted out a picture of some DSA members of my organization, Democratic Socialists of America, waving a red flag, saying that while Kamala Harris, senator from California, was speaking at this anti-GOP healthcare bill rally, they started chanting in support of single payer. Now, as you can imagine, the comments section was not really that pretty, with many liberals saying that criticizing DSA, some even saying that we are worse than Trump supporters, which, okay. So I'm just not even going to bother responding to that. But there have been there are about three main criticisms that have been leveled against DSA. The first one is that heckling Kamala Harris was sexist and racist, that this is an example of purity politics, and that we're hurting our own cause. Now, as for the first criticism, that this is an example that this was racist and sexist to heckle her, I can see where they're coming from. Kamala Harris has been interrupted by people in the Senate, and very much in a racist manner, namely by John McCain. But in this context, it's really just an example of liberal identity politics. While racism and sexism are serious problems, they need to be overcome. And this is not an example of this. This is what liberals do. They bend discourse about race and gender in order to support the status quo and the powers that be. Now, many people also added that it was wrong for DSA to heckle her because Senator Harris was a champion for marriage equality in California. Now, this criticism simply doesn't make sense, as it doesn't. One, DSA would have done this to a white man, and they have done this. We have done this, and there are plenty of videos online of this as well. And two, this was about a policy, not because of the issues, not because of her race or gender. And the fact is that DSA members were already there carrying signs saying single payer now, and that it was immoral to make profit off of healthcare, which we would seek to abolish with single payer or another public healthcare system. I'll be talking more about that here in a moment. Now, the fact is, in order to make change, you need to stand up to those in power, and Kamala Harris is in power. She is a senator and she is a sitting elected official, so we need to be willing to stand up to her. The fact is, she hasn't been very vocal on the issue of single payer, and most indicators suggest that she's not exactly a friend to the cause. So criticizing her over this is not only rational, but something that should be done. Now, this leads into the second claim, that this is purity politics. And they say that this is another example of far-left purity politics, and that is a privileged position for us to be taking. Now, this criticism I've heard a lot, but frankly, I don't think they understand what purity politics actually is. They don't really bother to understand our side, so I'm not surprised. But for single payer is already a compromise position for us. We would prefer to implement what they have in Britain, which is a national health service, where both the hospitals not just both the hospitals, where the hospitals are government funded and state owned and paid for by the taxpayers, and there is no insurance at all for these. It's called the NHS. It's an amazing system. The Commonwealth Fund recently named it the #1 healthcare system in the world. I'll include that link in the description below. And it's something that I would prefer. And this is what many in socialists believe. But single payer is what they have in Canada. It's an insurance-based solution where hospitals are kept in the private sector, but the insurance is national, is public. So what this means is that you have a public insurance for private hospitals. And this is a compromise solution. This is what they have in Canada, and it works decently, but it could be an NHS system we would think would be a lot better. We went to implement this in the United States, though, because we already have some working systems like Medicare and Medicaid, which are insurance-based, which expanding those out to everybody would make a lot more sense. under the current system. Now, this is already a compromise position that we're taking right now, which maintains our principles yet works to be more moderate and more practical. So this isn't really purity politics. We're just demanding that we stand up for principles. And this isn't really a privileged position to take, seeing as the current system is already hurting those who lack privileges, people of color, minorities, people who are, especially women, are also being hurt. Young people are being hurt by the current system, and most importantly, the poor are being hurt by this system. So this isn't exactly a policy of privilege here. This is a policy of necessity. This is a policy of urgency that we are demanding here. Now, the final criticism is that we're hurting our own cause. I just have to side this one. They say, oh, you stand up to politicians that oppose Trump. That's real effective. Well, that's how you get effective opposition. And frankly, the Democrats aren't being a very effective opposition. So yes, we do need to stand up to them. And frankly, they're not supporting our cause as is. So not standing up to them would be hurting our cause. Their logic here simply doesn't make any sense. And seeing as the Democrats had a chance to implement single payer back in 2009 to 2010, but they didn't, just shows how much we actually need to stand up to them. And this is it all kind of gets back to Neera Tanden, the director of the Center for American Progress, is trying to put up this, we need to be a united resistance and unite behind the Democrats, and Jill Stein, it's all her fault, and these hard left socialists and progressives, they're also to blame, when really what she's saying is be more moderate. And she's saying we need to uphold the Clintonite Democrats as a means of defeating Trump, when they've shown that they cannot defeat Trump. In all of the last special elections and in the general election, we saw that the Clinton Democrats cannot defeat Trump. So we have to stand up to them, and we have to push for hard progressive policies of the left that will actually make real change in the pursuit of justice in this country. Not doing this is hurting our cause, because if we have to actually fight for our cause in order to support it. That's just how this works. They're not doing a very good job standing up to Trump, and frankly, the problem isn't just Trump, the problem isn't just the Republicans, the problem is the whole damn system. We're trying to overturn the current system that we have, the system of capitalism, and make serious systemic reforms to our political process as well. That's what we want. So we're not afraid to stand up to Democrats or Republicans, and we'll do that as much as we can. And frankly, I would say it's probably better that we stand up to Democrats, because they're more likely to be convinced. They are already more they're not left, but they're center. Meanwhile, the GOP has gone so far to the right that it's no longer even on the spectrum of sanity. So we have a chance to actually shift a lot of Democrats to our side. We don't really have that chance with a lot of Republicans. At the end of the day, this is just the problem a perfect example of the problem that I have with liberals. They think, oh, you just got to stand up for what we have right now, for the status quo, and fight against those who would make it worse. And so we got to stand up for Planned Parenthood, we got to stand up for the Democrats, when frankly these institutions have failed us. Planned Parenthood recently came out against the single-payer bill in California, and they opposed the single-payer referendum in Colorado. If they're not going to stand up for universal health care, if they're not going to stand up for health care as a human right, I'm not going to stand up for them. It's that simple. And I will oppose them on that issue. I oppose the people that go out there and protest them because they're assholes. But I'm not going to stand up for Planned Parenthood right now because they're not going to stand up for what's right. And I'm not going to stand up for Kamala Harris or any of the Democrats if they're not going to stand up for the human right to live, which requires health care. If you don't have health care, you're likely to die. That's just a fact. If you have a preventable illness or preventable or curable disease, something like that, and you don't have health care in our current system, you will die. It's that simple. So this is just my quick take on that. Thanks for watching, everybody. I will be doing an episode on Chris Kobach next week. Please subscribe, like the video, comment if you have any more comments to say on this, on the issue of healthcare, single payer, universal healthcare, any of that, Kamala Harris, Planned Parenthood, you name it. Please let me know. Like, subscribe, share. Thanks, everybody. And as always, solidarity.